Now, we've told you about this before, but it's really worth talking about again. A new resource coming to New York State to help with mental health treatment. 988 will be a hotline for anyone experiencing mental health crisis, meaning they only have to pick up a phone and dial those three numbers. Advocates say it's an important tool, but they're also sending out a warning. As Spencer Conlon explains, they're worried there may not be enough staff to actually cover the demand.
Mental health advocates across New York are celebrating a new resource for people living with mental illnesses. It's called 988.
We've seen all too often what happens in communities when the response to a mental health crisis is a 911 response and not a mental health response.
As we've reported, 988 will serve as a hotline for people experiencing a mental health crisis and will help transform how the state responds to such emergencies. But advocates like Sebrina Barrett, the Association for Community Living's executive director, say the new tool is highlighting another crisis.
It's not going to be helpful to have 988 if there's no one there to answer the call when someone needs it.
ACL is an organization of not-for-profit agencies providing housing and rehabilitation services to more than 40,000 New Yorkers battling serious and persistent mental illness like schizophrenia or bipolar disorder.
What our members do is we save lives and we save money.
Barrett says right now 1 in 5 jobs are vacant. And as a state-funded organization, filling that gap can be tough.
There's a limit to that funding. And unlike corporations who can raise hourly wages in order to compete for employees, our members can't do that.
Dolores Woodson works in the Human Resources Office at Mohawk Opportunities, an ACL member based in Schenectady.
Our talent pool has shifted in the fact that we're getting not only less applicants, but the number of qualified candidates is even more so shrunk.
Woodson says at the start of the pandemic, applicants were concerned about child care.
Now it's more so that the pay isn't always what they're looking for.
The lack of workers and turnover is also proving to be counterproductive in their work with clients.
Sometimes they have a hard time establishing trusting relationships to begin with. So when they do establish that trusting relationship, it's really important for their recovery.
Kelly Nutter has worked with Mohawk for more than 30 years and can't recall a time like this.
People once looked at nonprofits for their benefits and their time off and the experience and the education, and now that's not a pull for applicants anymore.
Their work continues, but Nutter, Woodson, and Barrett are concerned staff could become too overwhelmed.
We've got supervisors who are doing overnight shifts at this point.
Barrett says if you're interested in human services and are looking for a rewarding experience, a job like this could be the perfect fit.
To come to work every day and see someone go from having to have 24/7 care to being able to live independently in their own apartment, to get a job, to get married. I mean, these are rewarding jobs.
For Spectrum News, I'm Spencer Conlon.
The FCC says phone service providers will be required to direct all 988 calls to the existing National Suicide Prevention Lifeline by next summer. But during the transition, if you experience a mental health crisis, pick up the phone and call this number, 1-800-273-TALK. That's 1-800-273-8255.